Good afternoon. My name is Sarah Fuchs, and I'm a senior specialist for the Community Education Department at the Muscular Dystrophy Association. We are thrilled to have you join us for today's webinar on care and planning resources for adults with neuromuscular disease. This learning event is a part of our larger MDA community education program, which focuses on bringing the neuromuscular disease community together around education and resources. Be sure to visit the community education section on mda.org for updates on upcoming events. We are recording today's event, and it will be posted online on our website for on-demand viewing at a later date. Everyone registered for today's session will receive that information in their inbox. Please know that all phone lines have been muted, but you can still ask questions. We'll have a Q&A session at the end of each speaker's presentation. Simply use the chat feature to type in your questions, and feel free to type your questions in as they come, and they will be addressed at the end of the presentation. For nearly 75 years, MDA has led the way in funding research to accelerate the development of new treatments, expanding access to care and clinical trials through the MDA Care Center Network, and advocating for access and inclusion for the neuromuscular disease community. MDA delivers its mission through research, access to care, advocacy, education, recreation, and engagement. Since its inception, MDA has invested more than $1.1 billion in neuromuscular disease research. Our MDA care centers are located at over 150 top medical institutions nationwide, providing care from clinicians who specialize in neuromuscular disease. MDA's advocacy network focuses on support for accelerated approvals and novel research, access to healthcare, accessible air travel, and more. This focus plays a vital role in shaping laws and policies that support the needs of people living with rare neuromuscular diseases. Our community education and recreation programs are designed to connect individuals and families. We are committed to building a nurturing environment where our members can share experiences, triumphs, and challenges. Every year, we offer over 40 educational programs, over 20 summer camps, and dozens of other community activities, both in person and virtually. If you haven't done so already, we invite you to join the MDA community by registering with us. Registering is free, and please see the link in the chat to learn more. Now it is my pleasure to introduce today's speakers, Lakelyn Eichenberger and Katie Fields. Katie Fields has a passion for career development, accessibility, and disability pride. Katie combines her expertise with her personal experiences as someone living with multiple invisible disabilities. She holds degrees in business administration and management from Webster University. Using her knowledge and lived experiences, Katie created the highly successful Access U program. This program is a free career development program designed specifically for college students with disabilities, aiming to equip them with the skills and preparation they need to start their careers successfully. As a disability inclusion consultant, Katie builds relationships with employers and educates the community on disability inclusion and allyship. Lakelyn Eichenberger serves as a gerontologist and caregiving advocate for Honor and Home Instead, the world's largest provider of home care. Lakelyn began her career in a local home instead, working one-on-one with aging adults. Today, she works to educate professionals, families, and communities on the unique challenges older adults face and the resources available to help them thrive. Lakelyn earned a Ph.D. in gerontology from the University of Nebraska. She has spoken nationally and internationally on the topic of caregiving and aging, and serves as a resource to major media, including Dr. Phil and Dr. Oz. Lakelyn has a passion for helping others and giving back to her community. Thank you both for being here, and Katie, I will now pass the time over to you.
Excellent. Thank you, Sarah. I'm going to share my screen and we'll get started. All right. Well, thank you all for tuning in and joining us. My part of today's session is really going to be focused on disability and work. We're going to talk a bit about accommodations and benefits planning. But I want to start this conversation off by saying I'm not a benefits planner. However, I've worked with so many disabled candidates who are seeking employment and navigating, wanting to work and fulfill their career goals while also managing their benefits. And so I know enough to hopefully be dangerous. I'm a disability inclusion consultant with Starkloff Disability Institute. We are a disability-led nonprofit founded in 2003, and our vision is disabled people thriving. We provide disability-led career exploration, career development, and community employer education. So first, we're going to talk a bit about navigating the accommodations process, and we'll talk a little bit about what common workplace accommodations are, where you can go to find those, and how to make that formal request. We'll also talk briefly about discussing your disability with an employer, as that is a common question we often get. Then we'll touch on benefits, and then work incentive programs that help folks to maintain their benefits while finding employment. And then we'll finish up with resources. So, starting with workplace accommodations. Accommodations are adaptations in our environment. Maybe it's assistive or adaptive technology. Maybe it's a change in a procedure or policy. And this is meant to level the playing field and ensure that there is accessibility built in so that you can be productive in the workplace. Common workplace accommodations. These include flexible work schedules with structured breaks, telework, so working from home, having a quiet workspace. I'm somebody who has ADHD. That's a very helpful accommodation to me. Some folks use assistive technology. Think of JAWS or Dragon, a magnifier or tactile buttons. Written instructions for those who maybe do better with written materials rather than auditory processing. That could be an accommodation. Often see adjustable height desks. If your wheelchair can't fit, beneath the desks that are there, an accommodation for an adjustable desk might be available. Alternative formats. So think of Braille or large print. Maybe it's closed captionings. Maybe it's ASL interpreters. This list is really not exhaustive. And what I want you to know is the accommodations process is meant to be an interactive one. So that means engaging with your employer, talking about what is the need you're trying to meet, and then talking through some examples of accommodations that will work best for you. So one amazing resource that I want to share with you, if you don't know it, is the Job Accommodation Network. You can find it at askjan.org. That resource lists thousands of accommodation examples. They can also look at the type of job and suggest accommodations based on that type of work. They have scenarios. They have support for employers to better understand how to accommodate their employees. It's an amazing resource, and it's going to have a lot of great examples of accommodations for you if you type in a specific problem you're having. Maybe you were in school and you used academic accommodations. It is a helpful website to kind of figure out how to translate those academic accommodations to workplace accommodations. Now, Ask Jan has several great recommendations about requesting accommodations. And the three things they want you to focus on are keeping it simple, putting it in writing, and talking to the right people. So what does it mean to keep it simple? It means you don't need to share every detail about your disability or your medical history. Instead, you just need to focus on what is the part of my job that I can't do because of my environment, and what accommodations might fix this problem, right? That's what you want to focus on. You also want to put it in writing. I suggest this because sometimes when we have these accommodation request conversations, if it's maybe in passing, if you don't write it down, it might not happen, right? And we want you to maintain documentation to ensure that this accommodations process is moving at a fair pace and that you are getting the things that you need. And if you don't have it in writing, sometimes it's hard to refer back to that to prove that you've made that request. To have, dates on hand, keeping it in writing is really, really helpful. That doesn't mean you can't have the conversation out loud, but it just means you do want to have some sort of written notes or documentation afterwards that, confirms the conversation you've had. That also provides you with documentation that might be needed if somebody's unwilling to give you an accommodation for any reason. Just having that documentation is really, really helpful. And then you want to make sure you're talking to the right people. For a lot of us, that's going to be the HR department, right? Human resources often handles accommodations, but certain employers have an ADA partner that maybe handles that process. The best thing you can do is when you start a job, you're likely going to get some sort of onboarding employee handbook. And usually within that handbook, it will tell you where to go to make that accommodation request. Now, let's also talk about what you might have prepared when you make that request. Not every employer is going to request documentation of your disability, but many will. And so having that documentation from a medical professional is really going to be helpful, having that on hand ahead of time. Now, that documentation doesn't need to specifically state your disability. It really just needs to be your medical professional stating, yes, this person needs this accommodation, right? It's also helpful to think about your strengths and how you've found success in your past, whether that's a previous position, whether that's in academics. Just keeping those successes in mind is something you can refer back to. And it really is helpful with problem solving when you're trying to figure out which accommodations might work best. Now, here's an example of what requesting an accommodation might look like. Dear blank, because the desks we have in the office are not tall enough to accommodate my wheelchair, I am requesting an adjustable or standing desk as an accommodation. Please let me know what additional information is needed for me to begin this process. Thank you. Right? It's in writing, so we're documenting that. We're not spending much time talking about our disability. It's not really relevant. We don't need to overwhelm them with that information. Instead, they need to know, what is it that we're having a problem with, and what are we requesting? We're going to try to keep it simple. Now, when it comes to talking about your disability with an employer, there are several recommendations I have. One, always speak positively or neutrally about your disability, and always discuss your disability as a unique strength, because it is, right? I engage with a lot of folks who are wheelchair users, who use consumer-directed services for personal care attendants, right? And they might not have formal work experience, but they've had to hire and train and fire and schedule many, many attendants over the course of years. And so when we think about what are the skills that we have that relate to our disabilities, we often have so many that translate really well into the work environment. So think about whether you have those management skills, or maybe you think outside of the box. Maybe you're an adaptive problem solver. Maybe you're really good talking with people. Figuring out how to discuss your disability as a unique strength is really, really impactful. Also, be prepared to discuss assistive technology and helpful accommodations, right? If you're engaging with an employer and they're not very familiar with disability, they might make assumptions about what you can and can't do. And so it's really helpful to come prepared with And this is how I accomplish this using this assistive technology or this accommodation. It really solves any of the perceived concerns an employer has. And again, focus on what's relevant to the job, right? I know some folks who are so used to sharing their disability history and their medical experiences that they sometimes spend so much time on that aspect that they're not focusing on what's really relevant to the job and what the employer needs to know to give them that accommodation. So focus only on what's relevant. Now, a lot of folks, when they're thinking about employment, have to navigate how employment will impact their benefits. And when I'm talking about benefits, in this conversation, I'm referring to SSDI, which is Social Security Disability Insurance, and SSI, which is Supplemental Security Income. So SSDI, this provides benefits to folks who have developed a disability, who are blind, and who are insured by workers' contributions to the Social Security Trust Fund. So this is something that comes from the Social Security Administration. It might be a monthly payment that you receive. And many folks who are on SSDI for at least 2 years are entitled to Medicare. That is health coverage that is paid for through this service. SSI is a program that makes cash payments to people who are aging, are blind, or have developed a disability and who have limited income. So if you've heard of Medicaid, that is the health coverage that those folks are eligible if they're qualified for that if they have SSI. If you're receiving these, a lot of times there are income limits or thresholds that if you make over a certain amount, you will lose these benefits. And that's a real concern for a lot of people. A lot of people have to make that decision of, well, can I work? Maybe I have a degree. Maybe there's a lot I want to contribute in the workplace, while also balancing the cost of healthcare, of personal attendance. Trying to weigh this and make this decision is not always an easy one. However, there are work incentives that exist, and these allow you to test your ability to work, or it allows you to continue working while still receiving benefits. So work incentives help a beneficiary, the person that receives that benefit. It helps protect their eligibility for cash payments or that healthcare coverage until they achieve self-supporting employment. So some examples of work incentives include ticket to work, a trial work period, also known as TWP, Medicaid while working, also known as 1619B, extended period of Medicare coverage, along with many other work incentives. One very popular is Ticket to Work. This is run under the Social Security Administration, and it is a program that allows you to keep your benefits while you explore employment and receive career services. So a lot of times you'll sign up for a program if you're eligible, and they will have somebody there that can kind of work through what services are you offered if you're looking for employment. Maybe you've never worked before. So they can connect you to employment networks or vocational rehabilitation offices. We'll talk about those soon. And those folks will help provide you career services to make sure that you're ready to find a job, right? They'll also help you explore employment. You might even be able to begin work. And throughout that transition, your benefits are maintained, right? And what's helpful is it kind of can create a steady decrease so that it's easier to transition from receiving benefits to maintaining an income through employment. Sometimes it allows you to maintain those benefits indefinitely. It really depends on your situation, the work that you're going to be doing. The best thing you can do is figure out if you're eligible and connect with your local Social Security Administration office. If you're 18 to 64 and you receive SSDI or SSI, you should be eligible for the program. You're able to call their Ticket to Work helpline at any time. It sometimes does have a wait, but those folks are really helpful at helping you to determine, am I eligible? What are the services that I might receive? Amazing, amazing resources. You can also visit your local Social Security office to talk through these things as well. And a resource that I really like is db101.org. It shows some benefits planning information in certain states. So you might check that out to see if your state is listed. Where do I go to find out about benefits planning and work resources? Well, I think the best site for that is choosework.ssa.gov. ChooseWork has amazing webinar tutorials as part of their archives that you can go back and refer to. And it talks about, they'll have different webinars on, benefits planning or navigating, starting a career while on benefits. They'll talk about different work incentive programs and how to get signed up for those. So really, really great resources. And they have a lot of information about benefits planning, including work incentives planning and assistance sources. If you've ever heard of WIPA, WIPA, that's what that stands for. And these are projects that are community-based organizations that work to enable beneficiaries with disabilities to make informed choices about work, and whether it's the right choice to go to work, how they can maintain their benefits, how they can have that successful transition to financial independence. So if you visit choosework.ssa.gov, you can see what WIPA resources are available in your area, because that looks a little different for each of us. I also want to share a few additional resources. So we've got, I mentioned before, JAN, the Job Accommodation Network. That's where you can go to find lots of information on workplace accommodations. ODEP, the Office of Disability Employment Policy. This is an agency that promotes policies and coordinates with employers at all levels of the government to increase workplace success for folks with disabilities. And they have a lot of great resources as well. If you're ever navigating disability discrimination in the workplace, the EEOC, the U.S. Equal Employment Opportunity Commission, that's going to be the office that enforces Title I of the ADA. So if you're ever wondering if you're navigating discrimination and you want to talk to somebody about that, the EEOC is a great place to go. And then finally, us at Starkloff Disability Institute, we are a disability-led nonprofit, and our focus is on career exploration and career development. So you can visit us at starkloff.org. And that concludes my presentation. I am happy to take questions.
Thank you so much, Katie. I will take over here for just a second. Alrighty, it looks like we do have a lot of questions for you, so we can get that started. Let's see here. So first question is, if you are 65 years old or older and are disabled due to muscular dystrophy, can you qualify for or receive disability benefits? And if so, how do you go about getting them?
Over the age of 65.
And disabled, can you qualify for or receive disability benefits?
Yes, yes.
And then if so, how do you go about getting them?
Yeah, so the resource I shared, if you visit the Social Security Administration, their website, ssa.gov, that is a great place to learn what benefits you might be eligible for. They have it's similar to a calculator, basically, that you can kind of plug in your information and it tells you what you might be eligible for.
Great, thank you. A question that seems similar, how would I get approved for disability benefits if I don't have a work history?
That's a great question. A lot of times you have to have some sort of substantial gainful activity, earning up to 10,000 that you've put into Social Security before you can access that. But there are exceptions. I'm not exactly sure what those exceptions are. So my recommendation is going to be visiting ssa.gov because it talks about, some of those exceptions.
Perfect, thank you. This one says, how can I tell if I'm entitled to Medicare after 2 years?
That is a great question. When it comes to health insurance, so SSA.gov has continued Medicaid eligibility page and continued Medicare eligibility pages. So you're going to want to search that, and it will tell you whether or not you qualify.
Perfect, thank you. I guess this question's similar. Can I go to college and receive SSI?
Yes, you can.
Perfect. Yes, we have lots of questions rolling in. This is great. How do I find out what income threshold is for SSI benefits? I think you just referred to those websites, unless you have anything to add for that.
No, it's updated annually, so it's good to check that the SSA website regularly just to understand how those income limits and asset limits change.
Perfect, thank you. So someone says that her son is 18. They have a special needs trust set up. He wants to attend college and have access to SSI disability benefits. That seems like you can do both of those?
Can you, sorry,
Yeah, no, it says the student is 18 and wants to attend college. They want to have access to SSI disability benefits. They do have a special needs trust as well. So could they still get the SSI disability benefits?
Yes. I don't think those, are mutually exclusive.
Okay. Are there any concerns with the current trends to eliminate DEI programs?
In the federal government, yes. What I will say is the ADA, Americans with Disabilities Act, has not been impacted. So employers with 15 or more employees are still expected to provide reasonable accommodations under the ADA.
Perfect. We'll take a couple more. I want to mix in some that were submitted upon registration. How do we find out about state-specific programs?
Yeah, so I mentioned that db101.org is a great site. If you also visit usa.gov/disability services, there is a benefits finder with resources for each state. Another helpful thing that I've found is just Googling your state along with disability benefits and seeing what pops up. Try to find state resources or look for disability-led organizations because they often have a lot of those resources as well.
Perfect, thank you. So someone said that they need help successfully applying for SSDI. It seems like they keep getting rejected and over again. Do you have any advice for people like that?
So making sure you've got extensive medical documentation, since that's usually a big requirement. You also need to meet an eligibility requirement of being unable to perform substantial work and having a disability or a condition that's expected to last more than a year. My recommendation is on the SSA's website, they have this disability evaluation. It's known as the Blue Book. And that talks about kind of the medical criteria the SSA uses to determine benefits claims and whether somebody's eligible. So my recommendation is Google Social Security Disability Blue Book, and use that as a resource.
Perfect. Thank you. I think we talked about receiving SSI in college. Can you also receive SSDI in college?
Yep.
Perfect. Will those programs ask how college is being paid for and factor it into their decision as far as income and assets?
That I'm not sure. What I do know is a lot of times, if you're working on self-development and towards your education, that's a really good thing. And so I haven't seen as many issues with getting an education while maintaining those benefits. But I don't have a good answer for you.
That's fine. Thank you. We'll take a couple more here. So let's see here. Just trying to make sure that we're getting through as many as we can. Let's see here. I am 32 with LGMD 2A and work as a drafter full time. Can I qualify for SSDI?
So if it's impacting your ability to work, yes. Also, if you want to maintain work, but maybe you need some additional financial support to, pay for personal care attendants or things of that nature, oftentimes you can qualify for SSDI.
Perfect, thank you. And then I'm going to take one more. So someone asked, why does SSDI fluctuate each year? For example, despite of cost of living increase and monthly SSDI being reduced by more than $300 each month, it still, fluctuates. So do you know why?
I don't really have a good idea as to why. Yeah, I'm not totally sure, but I know how frustrating that fluctuation can be when you're trying to plan for next year and you don't know what to expect. It's challenging.
Absolutely. Well, thank you so much, Katie. Really appreciate it. Um, just to consider time, I do want to pass the time over to Lakelyn so you can start your presentation. And then again, just for the audience, so you know, we will be doing more questions and answers session after Lakelyn's presentation.
Right. Share my screen. Okay, hopefully everyone can see that.
We can see it.
Perfect. Well, thank you, Sarah and MDA for having me, and Katie for that very informative presentation. My presentation really focuses more on care planning and resources. And as you heard in my bio, I'm a gerontologist. So I study aging across the life course and have spent the majority of my career focused on older adults. But I also work with caregivers across the lifespan in some of my volunteer work through my board membership with the National Alliance for Caregiving. And I also recently joined the board of directors for Mosaic, which supports the IDD community. So I'm learning more and more about the care and resources available across the lifespan. But I do give you that as my background, and kind of set a little context as to why you might see older adults referred to more in my presentation. But I think what's important to consider is that we're all aging. People of all abilities are aging. And as we get older, we will need support and resources. And if you do have a disability or a neuromuscular disease, you might need those resources perhaps sooner along your journey. And it might be sometimes difficult to navigate the long-term care continuum as somebody who maybe is younger than the quote unquote typical age that is receiving services. So again, you heard all about me. My name is Lakelyn, and I wanted to start with this slide. And intentionally, it's very confusing. And there's a lot going on. And I did cross out the word senior, and I left care continuum because this graphic shows that there are a variety of options within the care continuum to support people as they age, or with the various needs that they might need a little extra help and support with to navigate daily life. And we're going to go through a lot of this care continuum, but you'll see that some of it spans across the level of care and supervision that's needed. It varies in cost. And so again, I don't mean to overwhelm you, but I kind of do in one sense, because I want you to know that if you feel confused and overwhelmed by long-term care planning, you're not alone. It's overwhelming. It is confusing. And so hopefully through our presentation today, I can help kind of to untangle a little bit of that confusion for you as we go through these various elements of the care continuum. But we know for so many people, their desire is to be at home, to remain independent within their living environment, wherever home might be for them, whether it's in a traditional home setting, whether it's in an apartment living, and that's people's main desire and goal. But for many, it will require some additional support and resources. And so we're going to talk, a lot more about that. But I think what's also important to consider is that the care usually falls to members of our family, and often those family caregivers, care partners, they do a lot to support the needs. Whether it's an aging individual or an individual living with a disability, that family member usually is the first to jump in. But we can find help and supportive services to perhaps fill the gaps where family might not be able or willing, available. We also can see supportive services helpful in tasks that family members don't feel that they're equipped to provide. Sometimes those more complex medical tasks are outside of that comfort level. And then also can provide a respite or a break from the caregiving role so that that person can continue on in their role as a caregiver. And so we're going to talk more again about all of this. But when you're planning ahead for care, it really is important to, of course, consider your current needs, any future needs, the support that you might need. Of course, finances is a big component of this. I mean, just by your questions in the chat, I know finances and planning for that element is so, so important. And then also, of course, communicating that plan with those that need to know, your family, those that support you, your healthcare team. And what's important to also consider is that when we're thinking ahead about the care that we need, it's not a one and done conversation. It's not a one and done plan. We do need to revisit often, especially when a major life event occurs, such as the maybe death of a spouse or death of a primary caregiver. Maybe your parent is one of your primary caregivers and passes away, or maybe there's a significant health event that happens, whether it's for the caregiver or for the individual care recipient, whoever needs that care and support. And now there's a new level of care that's needed, or there's more limited mobility, or maybe the person is now needing the assistance of two individuals to be transferred, those kinds of things. Or maybe there's an additional diagnosis or a new development within the diagnosis. And so we need to revisit those plans. So again, need to assess, what are the current needs? What could the future needs look like? And start to research options, because what we know is that a lot of times it can be challenging to find care and support, and it's not something that just happens overnight. And so if you're able to do your research ahead of time and start to look into the services and supports that you need, hopefully when you do need them, you're not having to scramble to find the resources. So it's really important to identify, who all is involved in your care team. Of course, family support. If you have family, friends, maybe your chosen family, maybe your biological family, and then start to piece together other support systems. And that's really based on the level of care and the amount of care that is needed. Sorry, I'm fighting the cold, I think that's going around right now. So please pardon me sipping on tea every so often. Um, so when you're evaluating the level of care and the amount of care, you want to think through, how long is care needed? Is it daily? Is it a few times a week? Maybe it's only necessary in the morning to help the individual get up and ready for the day, and then in the evening as the day winds down. Or is it around the clock care that's needed? And when is it most important? Is care during the day so that the primary caregiver can go to work? Is that important? Or is it overnight care so that the primary caregiver can get a good night's sleep and rest peacefully, knowing there's somebody there to support the care recipient or to support you if you're needing that extra support. So, really thinking through the need from a variety of perspectives. And it can be kind of helpful to evaluate the need from the perspective of the type of care that's needed. So in our industry, we have ADLs, activities of daily living, which may or may not be a familiar term to you. We have instrumental activities of daily living. So those are IADLs. And I realize my acronym on that is missing the I, so I apologize. That's an edit I need to make. But the instrumental activities of daily living, things like driving, preparing meals, housework, managing finances, medication reminders, even daily tasks such as telephone use. And then those activities of daily living are more hands-on level of care, assistance with eating, dressing, bathing, restroom, transferring, and those types of needs. So again, kind of evaluating, okay, what is the need today in the present moment, and what might the need be as time progresses or as the individual progresses through the disease or the general decline, so you can anticipate what the need might be. And then for some individuals, there might be additional medical tasks that are needed, whether it's therapies, IV injections, could be more advanced care like tracheotomy or ventilator, those kinds of things. So again, kind of using those three categories to evaluate, okay, what are the needs? And so that will help you determine the type of care that you might need down the road. And we're going to start with the types of care that can be received in the home. And then we're going to talk more about community living. Sometimes people call it institutional or facility care. That's a term, those are terms we're trying not to use in our industry, where we talk about them as community living. So again, we'll start with the care in the home. So home health care, sometimes terminology of care in the home can be confusing because you have home health care, you have home care, you have hospice, you have private duty. So I'm going to try to help distinguish those different types of care in the home. So home health care, because it has that word health in there, is going to be a more skilled level of care. So usually individuals receiving home health care are homebound and have medically necessary care. The providers are more of those certified individuals trained as a nurse or a therapist. The agencies that provide home health care are generally Medicare, Medicaid certified. And depending on the level of need of care, sometimes the duration of visits can be shorter, and sometimes it can be for a shorter term or intermittent care. So I have the examples of the types of care listed there. It's a lot of those medical tasks that I mentioned earlier. occupational therapy, physical therapy, pain management, IV, injections therapy, and the payment options. I know, again, payment is a top concern for so many people. Medicare, under certain circumstances, will cover this type of level of care, and the same with Medicaid and private insurance, and some VA benefits or TRICARE will also cover this level of care. So next, I wanted to talk about private duty nursing. This is often a service provided by a registered nurse or an LPN, and it's really customized based on the needs of the individual. And often we see private duty nursing assisting with those things that are listed there, tracheotomy, ventilators, a central line, those that really do need that skilled level. And often the private duty nurses can be covered sometimes by Medicaid, private insurance, or private pay, which is out of pocket. And so these types of in-home services, they can be pricey. They can be expensive. And I do want to acknowledge that. And we're going to talk a little bit more about agencies versus independent contractors. Sometimes that can impact the cost. So we'll talk more about that in just a bit. And then there is home care, and that's really the industry I work in and have worked in for the past 12 years. And in home care, if you think about medical task versus non-medical, home care really is more of that non-medical category. But I like to remind people that there is a lot of skill that's involved in providing non-medical care. So often the home care aides are considered professionals. They are generally trained to provide this level of care. And this service is very customizable, whether 24 hours a day or a few hours a week. And really, they can be an additional set of eyes and ears in the home or an extension of the family. And so you can see also, examples of the type of care that can be provided: medication reminders, household tasks, nutritional needs, bathing, incontinence, transportation, and also for those maybe that have cognitive impairment support, such as kind of memory care at home, and can support a family that is on hospice. And we'll talk more about hospice in a bit. Payment for home care, long-term care insurance can sometimes cover this type of care, same with veterans assistance. Some Medicare Advantage plans are starting to cover home care, but it is a small portion of them. And then Medicaid waiver programs will sometimes cover home care under what is commonly referred to as homemaker services. But I will say at this point in the US, primarily private pay is the main funder of home care. So let's start talking more about the community living that we're seeing kind of pop up all over. We know that as the population ages, we're seeing more types of care being put into place to support them. And so, as I mentioned earlier, if you're an individual or you're caring for an individual living with a neuromuscular disease, you might be needing support at a younger age than the quote unquote traditional customer or patient of these types of care scenarios. And so that can present a number of challenges. We can talk more about that as I go through these next couple of slides. But when we think about community living, kind of the entry to community living is in the category of retirement or independent living communities. And there are so many different variations of independent living. It really is an apartment that an individual rents within a larger community setting. Often in independent living, there are included maybe meals, housekeeping, transportation. There might be activities that are arranged by the community. And there is an element, of social engagement. And these settings are primarily privately paid. And so it is important to ask a number of questions when you're looking at these types of communities of, the costs involved. You might want to ask about bringing in outside help to support you. Sometimes if you move into, let's say, an independent living, and you're starting to need more care but don't want to move to the next level of care just yet, being able to bring in care to help you stay there, it might be really important. So you want to ask about that. And then also understand, when would I be required to move? Because some of these community living settings, per state requirements, can't have individuals within their community that require a certain level of care. They need to move on to another level of care. So the next level would be that assisted living facility. Again, there's striking diversity amongst these assisted living facilities. They're also generally privately paid, at least here in the United States. They are ideal for those that, still want kind of that home setting, but need supportive services. Also, there's usually an active social element to these living environments. So again, you really do want to understand, if you're planning ahead, what is included in the monthly fees. Are there any additional services that come at an extra cost? A lot of times there's kind of the base service and then an additional fee for things that you might need, such as uh, additional bathing. Bathing might be included twice a week, but if you want additional baths or showers per week, you want assistance with that, it might cost extra. So that is really important to consider. And then also, if the level of care increases, can you bring in care? Similar to independent living. And then, are there options for financing? We know, again, that assisted living is generally privately paid. So asking about options for financing. And then also understanding staffing ratios in these various, I think that question really applies across these various community living settings, so that you understand the expectation. It is not that one-on-one care and support that you would receive perhaps, in the home if you had a home care aide or a home private duty nurse. So you want to understand the ratio and the expectations for that assisted living community or facility. And then there's skilled nursing. And this is often also referred to as a nursing home level of care. And this is for individuals that really do need around the clock care, that have complex medical needs. Often if they're two-person assist, that skilled nursing level of care will be needed. And Medicare and Medicaid may cover skilled nursing facility level care depending on the individual and the circumstance. And you'll hear me talk about that a lot. Unfortunately, the way our society in the US is set up is payment options for care and support. I wish there was more. I wish I had more resources to point you towards, but sometimes it is very state specific, especially when it comes to Medicaid. And then sometimes Medicare will only cover a stay in a skilled nursing facility under special circumstances. For example, if you were hospitalized and then you need to go to a skilled nursing facility for rehabilitation services, and then the idea would be to then go home after. So that might be a situation where Medicare would cover it. So again, it's really important to start doing your research ahead of time before you need these levels of care, so you can really understand the options and the payment and the financing side of things, and to understand that there are some communities that will accept Medicaid as a payment source and some that will not, or they might only take a certain number of individuals on Medicaid benefit, and so you'll need to understand what that might mean for you or a loved one if you need to transition to Medicaid. So again, it gets kind of complex. When it comes to skilled nursing, the Medicare.gov website has a great resource, nursing home. It's a nursing home compare. Nursing homes are highly regulated by the government here in the US. So you can go on there and compare ratings and understand which communities, skilled nursing communities in your area have good ratings and what might some red flags be. So again, I have some important considerations listed here. I'm going to continue to move through the slides. I can get very passionate about this and talk for a long time, so I want to be sure we leave enough time for questions at the end, so I'll keep moving along. I did want to touch on hospice and palliative care. This is a really sometimes challenging topic to discuss, but we all are going to pass away someday. We have a 100% death rate here in the United States, across the globe. And so we all will come to the end of our life. And some might be sooner than others. If we're able to learn about it and talk about end of life and our wishes, that's a really important part of this overarching conversation. And sometimes people are afraid to talk about hospice and palliative care. There's a lot of misconceptions about it. So I just wanted to just briefly touch on it here because, again, it is really important to talk about and think about as part of care planning. So palliative care, you might have heard of it as comfort care. Sometimes they reference it that way in the news. It really is a specialized approach to treatment of patients with serious or life-threatening illness. And really the goal is that symptom relief to help manage pain and stress of an illness and really improve quality of life. And what's neat is it not only supports the individual, but also the family members. And it really is provided by a team of specialists. So somebody who is going through a serious illness, they might also receive palliative care. And it might not mean that they are at the end of their life. They might be on palliative care while they're receiving treatment, perhaps for cancer or another diagnosis. And then they might stop receiving palliative care at some point. Hospice is a type of palliative care. So while palliative care is not hospice, hospice is palliative care. I hope I didn't confuse you even more. But hospice is a type of palliative care, and that is for those that are at end of life. So typically it's for those that have a diagnosis of 6 months or less remaining in their life. They're not seeking curative treatment any longer, but the goals are the same: comfort, pain relief, dignity, respect at end of life. It is that wraparound service provided by that team of specialists, focused on the individual, but also supporting the family. And one misconception that I often hear is, well, I need to go to hospice. Hospice is a place, and that's not true. Hospice is a service, and it can be provided anywhere. It can be provided in your home. It could be provided in an assisted living community. It can be provided at a nursing home or at the hospital. So it is not a place, but it's a service. And it's generally paid for by insurance, Medicaid, or Medicare hospice benefit. So I just encourage people to talk about end of life, what the wishes are, to have advanced directives. I don't have that on a slide. That's a miss on my part, but having those advanced directives really helps to outline for your family, for your caregiver, what your wishes are at end of life, so that family members aren't left guessing what you want when your time is coming to an end. And then one final term I wanted to talk about is that respite. I mentioned it briefly earlier at the beginning of the presentation, but again, so many people rely heavily on their family to care and support them. And so that can be overwhelming. Family members or caregivers, care partners, they can quickly reach burnout if they're not taking care of their own needs. So respite is time away from the caregiving responsibility for an opportunity for them to do just that, to recharge, to take care of themselves. And respite can be provided by family or friends, saying, hey, family member, would you come over and be with the care recipient while I, the primary caregiver, can get to my own doctor appointment, or, you know, uh, take time away to make sure my own needs are met. Friends could also do that, neighbors. Some volunteer organizations will provide volunteers for the purpose of respite, especially if you are in that older age category. The local area agency on aging can be a great place to go to find more about respite services. And it can also be provided by professional in-home care services, such as the services we provide at our organization, Home Instead. So that care at home, specifically, we're kind of pivoting back to care at home for a little bit, because again, that's where most people want to be. Often that's where, when we start our care planning, we usually start looking into care in the home first before we start to look for care externally. Usually that care, whatever level of care you kind of determine that you need, they'll usually come in and do an assessment to see, what are your needs, talk about the schedule and customize it based on the need. Again, I mentioned usually it can range from several hours up to 24 hours a day, depending on the level of care needed. And often there is a regular schedule of care, but sometimes, again, it can be used for respite and be more intermittent. So that's something to just keep in mind. I mentioned earlier that I was going to talk just briefly about provider types. When you're looking into care, a lot of times people will say, oh, going with an agency, it's so much more expensive than hiring someone privately. And that can definitely be true. When you do work with an agency, they are the employer. So they take care of all the scheduling, the hiring, background check, the training. They handle all responsibilities as the employer. So you really just, pay the agency the fee, they take care of the rest. And then the kind of opposite end is the independent contractor or the private hire, where you, as the person that has hired them, you are the employer. So you take care of paying them and scheduling them and addressing, any employment issues that come up. And there is kind of one that's in the middle. They're called registries. So that might be like a caring.com, where they kind of vet their care providers. And you can go onto the website and search for the type of care provider you need. You might pay a fee to care.com to be able to hire that care provider. But then once you do hire them, they are working for you. They don't work for care.com. So I hope that helps as you go through. There are pros and cons. Again, hiring an agency might be nice because they can, again, take care of all those employment related issues. If the care provider calls in sick, they can likely provide backup. But again, a con is that it might be at a higher cost. So hiring independently might be saving you in terms of finances. But again, you're taking on some of that extra responsibility. Sometimes that involves a lot of stress. As Katie mentioned in her presentation, what a great skill for someone to develop, to be hiring and training personal care aides and that sort of thing. And we do see families doing that often. But I included in this presentation some important questions to ask when looking for an agency versus looking for an independent individual. You want to ask questions about how they hire their employees, the skill and training that they have. I won't go through all of these individually. Again, I want to save time for questions. And then also you want to ask questions about the services. Are there minimums? Are there contracts? Are there restrictions on the level of care? Are there those backup caregivers if somebody calls in? Those kinds of things. What's the communication between the agency, the family, and the care provider? Those are really important questions to ask and understand. And then when you hire privately, of course, you want to get to know them, get to know their history, what their training and background is. And if possible, it's really important to ask for references and do reference checks to make sure that, the people they've worked for in the past would recommend them and that sort of thing. And so I also included some questions for reference checks, but I think one important thing I wanted to touch on here is if you are hiring someone privately, you want to consider an employment agreement or contract and a formal kind of time tracking sheet that kind of outlines the services provided. Why this is important, there's a great resource on care.com. The article is called What to Include in the Contract. I don't want to get too deep into it, but it's important because it establishes a formal employer-employee relationship, and that can be important so that there is not any confusion around, if you have gifted this individual or kind of paid them under the table kind of a thing. Those kinds of things might come into question if you are trying to become Medicaid eligible and those types of things. So again, encourage you to research, those important things to consider if you do hire privately. Again, I know cost is top of mind. Typically, care in the home is charged by the hour, and usually the rates really vary. It varies on the level of care needed. It varies, again, if you hire an agency versus an independent individual. If you live in an urban versus rural community, the rates are going to be very different. So again, that's why it's important to start looking into this type of care. And the payment options. So we've covered a lot of the payment options already, but I did want to share the Genworth Cost of Care Survey as a really helpful resource. And I took a screenshot of this. And about every 2 years, they research on a national level the cost of care, and you can even kind of drill down to your zip code. So again, as you're planning ahead for the type of care and maybe the cost of care, going to this Genworth website, you can just Google Genworth Cost of Care Survey. You can look at the various levels of care. So as you can see, these are the monthly average across the entire US. And again, this is just an average. So it can really help you understand the potential cost of care. And you can even down here, you can indicate the number of hours of care that you might need. Again, it's just a really helpful resource as you are planning. But back to that building a plan, you really do want to research those options early and familiarize yourself with payment options. An example, Medicaid might have a long qualification period, or there might be waiting lists for things like Medicaid waiver in some states or communities. So it really is important to start looking into these things early to make sure that you can get on a waiting list or start to look into the Medicaid qualifications or Medicaid spend down before it's too late and you need services yesterday, kind of a thing. And it's also important to discuss a backup plan for the individual and the care partner. Of course, when we're planning, we want best case scenario, plan A. We want, for many people, that's, stay home as long as possible. But we know, none of us have a crystal ball. None of us can tell the future. So we do need to consider backup plans. What if the level of care I need exceeds what can be provided at home? Okay, well, that's going to be plan B. So let's look into options for skilled nursing facilities in our area. Or what if my primary caregiver, my care partner, they fall ill and all of a sudden they're no longer available to care for me, or they're hospitalized temporarily, or they themselves are now disabled and can no longer care. What is that backup plan going to be? And those, again, are tough conversations to have, but they're really important. And again, often you need to plan ahead for those kinds of things so that you're not caught off guard in the moment. So often I see people scrambling in crisis mode, trying to make decisions, trying to research, and they're just so overwhelmed. So kudos to all of you for joining this webinar, planning ahead, and starting to think about what you might need, or maybe your family member or loved one might need. So I'll just wrap up with a little bit about Home Instead if you're interested in learning more. We are a worldwide company and employ over 100,000 care professionals. And each year we provide over 90 million hours of care. And so our level of care is, again, that home care. So we're not going to have, the nurse, but we do have trained care professionals that can help with a lot of those hands-on tasks. So if you're interested, you can visit our website. We're in the process of rebranding, so thank you for giving us a little grace as we're transitioning from purple, which you see here, to that green you saw on the previous slide. So these are great resources. They're free downloadable on our website on homeinstead.com. You can just search for these titles. The home care solution goes through the various types of care at home. The action plan for successful aging can help you kind of think through planning as you get older. The funding solutions guide can be helpful in breaking down the various funding options. Again, here in the US, it's not perfect. A lot of times it's like putting together pieces of the puzzle, using a little bit of funding from this source, a little bit of funding from this source to kind of piece together. And that's not ideal. And I hope, my true hope is that someday we have better options for that. And then one key element to staying home is creating a safe environment. We really didn't dig deep into that. But, if your home is not set up for success, just like Katie had mentioned, making sure your work environment sets you up for success. If your home environment is not setting you up for success, then that can be a barrier to staying home. And so this home safety checklist walks you through each room of the house and helps you think through any potential safety concerns that might arise and suggests some modifications. Again, you can find that all out on homeinstead.com. And then I also host a podcast called Caregiver Chats. Again, it's focused more on caring for aging loved ones, but really focuses on caregivers, care partners, and a lot of the challenges and needs that group of individuals have. So you can find me on Spotify or Apple Podcasts. Just search Caregiver Chats, and you can find some additional helpful resources. One episode I'll call your attention to is what is home care, and we really dive into care at home. There's another episode I should have put up here on the care continuum, and so I talk with a guest about all those various levels of care in a little bit more detail. So encourage you to check those out as resources. So I'll turn it back over to Sarah for questions, but want to thank you all so much for your time today.
Perfect. Thank you so much. We do have a lot of questions, so we will get right into it. Let me just get my screen shared here. All right, let me get to the questions list. So, how can you find resources and benefits when Medicare and the extra benefits programs don't cover home health benefits?
Oh, that's a really tough question. Because as I mentioned, there's not a lot of great options for that type of in-home care and support. So I would say, going back, I had a slide on the various funding options. So really kind of going through, looking at your individual situation, and reaching out also to community organizations. I know Sarah had mentioned that MDA has a great resource center that can really help you kind of drill down to your local community for resources and support. Sometimes, again, states or counties have their own programs. So looking into those, exploring those resources can hopefully be helpful. And it's sometimes kind of like a rabbit trail. I hate to I don't want to be discouraging, but you might have to, start somewhere and then might you might find more and more resources as you go along. But I would encourage you to look at state specific resources. That's always a good place to start.
Yes, I know that, every state is different, every county is different. So I would encourage everyone to contact the MDA Resource Center. I believe it's already in the chat. We'll also be wrapping up with information about the Resource Center. If you call or email, you will get a live person. They get back to you in, I believe, 1 to 2 business days at most. And they can help point you in the right direction and get you started. I also want to remind everyone, I know this came up a little bit in the chat, we will be sending a recording of this presentation in the next few weeks to anyone's inbox who registered. So even if you know someone who registered and is not here, they will also receive the recording. So next question. This it's a little long, so let me know if you need me to slow down at any point. So
Okay.
the issue is finding nursing services through agencies. The
Mhm.
nurses' aides are a lot of times unable to help with outside care. For instance, my nurse's aide sent by my agency is allowed to run errands for me, but I can't go with her, which I understand. But then they send a nurse's aide who doesn't have a car and comes by bus. So how do you navigate those issues?
Ooh. Yeah, that's a challenge. I mean, ideally, the agency should match you with somebody who meets your needs. So I think in those situations, I know you never want to feel like a pest, like you're bothering, but you are the care recipient, you are their client, their customer. So I think it is important for you to voice those concerns and frustrations, especially because, being able to get out or have that individual get out and get your necessities, food, running your errands for you, that is important. You need those things. So I think bringing those concerns up with the agency or the care provider is important. And sometimes it does, I will, from a provider perspective, sometimes it does take us a couple of tries, if you will, to find a good match for you. So I will say, try not to get discouraged if maybe the first person you're matched with or the second person you're matched with isn't the perfect fit, but the agency won't know that unless you're voicing that feedback to the agency. So make sure that you're expressing, hey, when we first started these services, the expectation was you were going to provide X, Y, and Z for me. The last couple of aides you've sent haven't been able to do that. And this is why. How can we work together? Maybe it's adjusting the time. Maybe they have more care providers or aides available, during afternoon hours versus morning hours. So if you, as the care recipient, can be a little more flexible with your day and schedule, maybe it opens up more options for more aides if you have afternoon care, if that makes sense. And I know not everyone can be flexible like that, but those are, some strategies that you can perhaps take to find kind of a happy medium, and find, hopefully get the care that you really need to help you, live your best life.
Yeah, no, great points across the board. And I also shared our MDA caregiver guide in the chat. So that also, I know you brought up some points about, hiring and asking questions and things
Yes,
like that. So that also includes information about that as well, just an additional resource.
fantastic.
Um, is there a resource for evaluating current home and living space for modifications with expected wheelchair needs?
That is a great question. I'm sure that there is one specific to wheelchair. The checklist that I provided towards the end is more general. It's not specific to wheelchair. But I would imagine, and I don't want to make this up, but I would imagine that maybe the ADA has a resource. Katie, I don't mean to bring you into Q&A, but would you happen to know if there are resources like that?
Hi. So it depends on your area, but I know I'm in St. Louis, and so we have some occupational therapists who have partnered with or have become real estate agents who help kind of navigate what are the modifications somebody would need to age in place, or to live in their home while using a mobility aid. So sometimes those resources differ based on your area. Let me see. I'll look online to see if there are any like toolkits,
Yeah,
your
I
checklists.
I was just looking at the UDS Foundation has kind of a checklist, and so does Free Mobility Solutions. But I love your suggestion, Katie, of an occupational therapist. If you have access to an occupational therapist, they would be a great resource. I mean, they're really trained to help people live in their environments. So certainly look into that. I know that there's also adaptive equipment specialists that are out in the world. I've interacted with many of them. They are fantastic and can help provide suggestions and resources. I see some people in the chat sharing, in their local communities, they have ability centers. So definitely look into those types of resources.
Yes, I was going to say independent living centers maybe might be able to help. And also if you attend an MDA care center, a lot of our MDA care centers are staffed with, multidisciplinary staff. So they have PTs, OTs. That might also be a good place to start if you have an appointment coming up. If you have any resources, though, while we're still on, feel free to share those in the chat. Um, this one I thought was interesting. So as a married senior, when might one start considering in-home care to relieve a spouse?
That is a really good question. I think, as we talked about, family is often the first to really jump in and help. And I think that you want to look for those signs of burnout in the caregiver. Um, you know, Often caregiving can really impact financial, physical, emotional, and mental health. So if you're starting to see signs of, emotional distress or signs, depressive or anxious symptoms in an individual, it might be time for them to have that time away from caregiving or to get some extra help and support so that they can address their own needs or have time away and and also paying attention to those physical um, kind of signs of stress and strain, is their own health and well-being declining? Sometimes there's a lot of physical elements of caregiving, a lot of lifting or, helping with transferring. And so if you're starting to notice kind of, you know, them physically kind of showing signs of fatigue or a lot of weight gain or weight loss. Those types of signs can point to maybe there's some extra help or support needed. And so I would suggest, I think as the care recipient, often we don't, they, the individual does not want to be a burden. Or as the caregiver, care partner, you want to be there for your loved one. You want to be able to do it all. And so I think having a conversation, opening up lines of communication is really important and key to that. Saying like, hey, I know you're doing so much for me and I appreciate it. But I want you to be able to tell me if you feel like you need some extra help and support, and we'll look into it. Or I don't want you to feel like you have to do it all. So I think sometimes just encouraging them to ask for help can be helpful because it's hard to ask for help. I think for anyone at any point in life. We're very independent people as Americans, and we want to try to do it all ourselves. So just encouraging them to ask for help when they need it, I think can go a long way.
Absolutely. And everyone needs help sometimes.
Exactly, exactly.
I'll do one more question and then we're going to have to wrap up. So, how do we get paid care when we're married have pensions, and Social Security?
Married, have pensions and Social Security. So that's a good question. Again, it's hard to make specific recommendations because I don't know the whole story. I don't know what level of care is needed in this situation. I think it's important to, evaluate how much care is needed and look at your financial situation to see, again, a pension. For some, that could be very substantial. For others, it might be just as much or equal to what you're getting for Social Security. So again, it might be a little bit of piecing together of the puzzle. I would say, think, is anyone in the married couple a veteran? A lot of individuals are eligible for veterans assistance, but they don't know that they qualify. Or, do you have a long-term care insurance policy that maybe you purchased a long time ago and you've been paying on, and now it's time to start utilizing that. So again, kind of it's piecing together the puzzle. I will also say, Sarah, I know that there was a question from the questions that came in ahead of time about a family member being paid to care. I think that's another common question that I get. And in some states, Medicaid programs do allow for family members to be paid as a caregiver. And there's a website that is called, I believe it's Givers. Let me just double check that. Sorry, joingivers.com. And that has kind of a state-by-state search where you can see, can I be paid to care for my family member? So I did want to throw that in because I had it on a slide, but I think I forgot to mention it. So thank you all for those great questions. Again, everyone's journey is unique and different, but I think the more we can plan ahead and research and attend webinars like this, hopefully the more knowledge we'll have and the more resources we can get connected to.
Absolutely. Thank you so much for sharing that resource. Just to make sure that we're respecting everyone's time, I am going to move ahead and just close us out. Lakelyn and Katie, thank you so much for your time and expertise and all you do for the neuromuscular community. Now I'm just going to close out. I wanted to extend a special thank you to Edgewise Therapeutics for supporting today's program. We again would like to thank Lakelyn and Katie for sharing their time and expertise with us today, and we want to hear from you. What did you like about today's program? What can we do differently in the future? Please fill out the brief survey that will pop up right after the webinar. Your feedback is very important to us, and throughout our presentation, we have mentioned the MDA Resource Center. You will be connected to a live person that can help you find resources local to you. You can contact them at the phone number here, 1-833-ASK-MDA1, or email them at resourcecenter@mdausa.org. Before we go, I want to highlight some upcoming MDA community education events that you may be interested in. You can learn more about these events by visiting our website, scanning the QR code on your screen, or by clicking the link in the chat box. First, I want to encourage you to check out our Next Step seminars, which are held throughout the year for newly diagnosed pediatrics, newly diagnosed ALS, and transition to adulthood. Learners will be able to participate in small group discussions, hear directly from expert clinicians, and learn from others who are farther along in their journey. Next, MDA is hosting a webinar on MDA's impact on neuromuscular research. This presentation will explain the impact of MDA-funded research on patient care and treatment advances and educate the audience on MDA's role in advancing neuromuscular research. And then I want to provide a link for you to learn more and register to become an MDA advocate if you're interested. The MDA advocacy team is hard at work on their agenda and can use your support. Click on the link in the chat box for more information about how to join our advocacy team. And last but not least, we invite you to join the MDA community. Joining is free and will help you stay up to date on our programs as well as the latest research. Please scan the QR code with your smartphone or visit the link in the chat. If anyone has questions after this webinar, please contact the MDA Resource Center and we'll be sure to get back to you. Thank you again to our speakers, and this concludes today's webinar. We hope to see you all again soon.